Welcome to our Women's Health Education Made Simple video series. My name is Tunde-Byass. I am an obstetrician gynecologist with special interest in early pregnancy loss and complications, and I work in the North York area. Women's Health Education Made Simple. It's a series of educational videos and handouts to help women understand issues related to women's health. I am one of the founding members of WAMS Canada. We have been on Twitter, Instagram, Facebook. You could visit our website. We have talked about pregnancy in the pandemic, periodic health, pregnancy loss, and a lot of other topics. Today, I will be doing the questions and answers on pregnancy loss and miscarriages. So early pregnancy loss is called miscarriage. This is a very common problem. In fact, 1 out of 4 pregnancies are lost, and majority of this happen in the first 13 weeks of pregnancy. Believe that more pregnancies are lost before women even realize that they're pregnant. In the United States, it's been estimated that almost 1 million pregnancies are lost every year. This is a staggering statistics. Women go through different kinds of emotions, ranging from shock, having been told when you have not expected a miscarriage after an ultrasound that the baby is no more. And this is common during your first ultrasound when you were not expecting that kind of news. Sadness, feeling alone, guilt, feeling responsible for the loss, angry at a system whereby you can't walk in and ask for an ultrasound, or angry at the system, the medical system, that cannot give you a definite answer as to why your miscarriage is happening or has happened. This can lead to intrusive thoughts, unwanted thoughts, and depression. The trauma has been shown to progress to post-traumatic stress disorder. Most people don't want to talk about this. Majority of women feel no one would understand. 85% of women will not even share this with their family or best friends. And there's a stigma associated with pregnancy loss. This is a campaign to help women to talk about pregnancy loss, to help others to heal, and to provide a platform for people to know how common this pregnancy loss is. And we want to connect with you. And this month, we also want to recognize women who are going through losses or who have gone through miscarriages in the past. People often ask that question, why me? I can tell you, losses can happen in anyone, regardless of your economic status, your profession, your religion. It is so common. Although losses seem to happen in older women, but it can affect any age group. John Legend and his wife, Chrissy Teigen, lost their pregnancy, and they were able to share this on the social media. That was very helpful and powerful, so that women know that they're not alone. So symptoms could vary from feeling nothing, which is the worst part of it. If you're undergoing a silent miscarriage, you have no symptoms, you have no bleeding, you're just confronted by news after an ultrasound that you have a miscarriage. Some women also could present with very, very minor bleeding or even spotting. And in the worst scenario, you can have heavy bleeding, passing clots, pain, and severe cramps. When women go through miscarriages, if you have heavy bleeding and pain and cramps that is severe, you should be going to the emergency room. The emergency room is equipped to treat all kinds of complications. If your bleeding is light or you have just minimal spotting and you're not having pain, you could go to your healthcare provider, which could be your family doctor, your midwife, or your obstetrician. Some hospitals that have early pregnancy assessment clinics. These are clinics specifically geared towards the care of women going through pregnancy loss and complications. Unfortunately, there's no prevention most times. Most pregnancies are lost because there's just no compatibility between the egg and the sperm. However, the reassuring thing is that over 90% of women will carry a pregnancy successfully to term despite any kind of miscarriages. You should take your folic acid 3 months prior to the pregnancy and continue with your prenatal vitamin. Stay healthy, stay positive, regular exercises, and feel good. So there are many resources available, including peer support amongst women who have gone through losses. In Ontario, there's Pregnancy and Infant Loss Network located at Sunnybrook. There's Bereaved Families of Ontario, Compassionate Friends of Canada, and internationally, there are organizations like Baby Loss. And I would encourage you to go to the website of 𝐃𝐈𝐒𝐂𝐋𝐀𝐈𝐿𝐿.on.ca. There are a lot of resources to help pregnant women undergoing complications and loss. Also, the Health Quality of Ontario has made a lot of resources available to women undergoing loss and complications. It tells you exactly what to expect, what to ask your healthcare provider, and what you also need to know when you have such a complication. Please be sure to visit us on social media, WEMS Canada. We have opened up a conversation on miscarriage and pregnancy loss. Be sure to check this out and also to share your pregnancy loss stories.